Hello, I'm Dr. Caroline, and welcome to Vibrant Health Naturopathic Family Care. In this video, I'm going to go over some of the most frequently asked questions that I get in free consultation so that we have enough time to talk about any questions that are specific to you and your case during our call. Some of the most frequently asked questions in a free consultation include, what is naturopathic medicine? What is homeopathic medicine, and are they the same? Are they different? How long are the appointments? How long does it typically take to heal? And can naturopathic and homeopathic recommendations coincide with Western medications or pharmaceuticals? So we'll just jump in. Hopefully this video won't be too long. I really appreciate you watching it through to the end to get as much information as possible before we chat about your case in particular. So naturopathic medicine, I'm a naturopathic doctor. I'm licensed in the state of Arizona and function as a doctor to anyone who is who lives within the state of Arizona. For those who reside outside of Arizona, I do work with clients as a health consultant or a health coach. A lot of the approach is really similar because the medicines that I recommend, the recommendations that I give tend to be over-the-counter recommendations that are generally safe for most people. The only difference is that I cannot function as a physician to anyone outside of Arizona. So in that way, I do not diagnose. If you're outside of Arizona, I will not be your physician. I cannot diagnose you. I cannot order labs for you. I cannot prescribe pharmaceuticals. But I do, under the health coach and the health consulting work that I do, I can give dietary recommendations, supplement recommendations, lifestyle recommendations, and things along that line. So naturopathic medicine is a holistic paradigm of medicine that specifically that the body is one system and that all symptoms are interconnected and interrelated. So in naturopathic medicine, if we're looking at you as a whole person, we're not chopping you up into your different systems. So if you have cardiovascular symptoms, I don't view those as necessarily separate from your GI symptoms, as separate from your central nervous system or emotional symptoms, different from your respiratory symptoms. All of the symptoms that you're having in whatever body system you're having them in, whatever part of your body, are all occurring within your body system. So I'm looking at you as a whole person, really trying to understand all of the different factors about you and your symptoms, your case, your life circumstances. So the paradigm of naturopathic medicine is based on 6 principles. So the first, do no harm. The second, to use the healing power of nature. The third, to identify and treat the cause. The fourth, to function as a teacher and as a guide in your case. The fifth, to treat the whole person. So really, again, looking at you as a whole. And 7, to work with the idea of prevention, to give lifestyle recommendations that help to prevent disease and illness down the road. Obviously, preventing an illness is much easier than turning it around. Recommendations with naturopathic medicine typically consist of dietary recommendations, lifestyle recommendations, supplements, and herbs. Along the lines of dietary and lifestyle recommendations, I really like to go at your pace. So I'm not the type of doctor or guide who forcefully gives a recommendation. I really like to give you my opinion, but I want to meet you where you're at. And I really am a big fan of baby steps. So looking for the small little ways that we can create change that over time will add up, and implementing, a few changes, one or a few changes at a time, get those to stick before we move on to greater and greater changes. That's my approach in that area. Sometimes people worry about that. Homeopathic medicine is a separate and distinct form of medicine, so separate from naturopathic medicine, although they are often used interchangeably by lay people. That's not the case. They are different forms of medicine. Homeopathic medicine was developed over 200 years ago and has been used safely and effectively since that time. It functions off of the principles of like cures like, minimal dose. So the minimum dose needed to affect a change in the body prepared through a series of dilutions, which helps to minimize side effects. We typically give one remedy at a time, so a single remedy. That's not always the case in my practice, but with classical homeopathy, we typically are giving one remedy at a time. That remedy is ideally matches the whole picture of your case. So all of the symptoms that you're having, both physically as well as mentally and emotionally, it should match all of those symptoms, because it is trying to get the closest match possible. When we get a really close match, we find that the body is then has been stimulated to have an effect of it has a stimulus to correct itself, essentially. And then again, these medicines, the homeopathic medicines, are individualized recommendations. So two people with the same diagnoses or the same symptom per se, wouldn't necessarily get the same remedy. So two people who have migraines may have very different symptom expressions of those migraines. One person may have a pounding headache, which is worse when they bend over, and they are nauseous and they are vomiting and they can't go out into the heat. They need a cold room. Another person may have a migraine, but it's localized to one side and it feels like a stabbing pain, and they really want to be wrapped up warmly in bed without nausea, and they don't have any nausea, something along those lines. So those would be two totally different pictures of a migraine, the same diagnosis in Western medicine, but two different pictures. They would get two different remedies. Homeopathic medicine is very safe and effective. It can be used at any age, with infants, with pregnant women, and even seniors included. All of these people and everyone in between are able to use homeopathic medicines. Homeopathic medicines can treat both acute and chronic conditions, so colds and flus, or broken bones, or accidents, injuries, along with anything chronic that you're likely seeing me for, some type of chronic condition. Homeopathy typically does not have side effects, which is really, really nice. It also doesn't force a biochemical pathway in the same way that a pharmaceutical drug does. So when we have found the correct remedy for your specific symptoms, we see your symptoms will decrease in intensity and frequency over time. The symptoms themselves just tend to drop away. We're not forcing your body to have a response like you might notice when you start a pharmaceutical drug. Homeopathy is effective for most people, and I truly cannot imagine practicing without it. It is such a lovely form of medicine that can really help turn people's issues and conditions around, that I would be hard pressed to practice without it. The next common question is, how long are the appointments? So for the initial intakes, I do the naturopathic intake and the homeopathic intake separately, two different intakes. And that is because I need a lot of time to gather all of the information about you and your life and your case. So the naturopathic intake is an hour and a half. That's one intake. And then the homeopathic intake is a separate intake that is 2.5 hours. Those are typically done like a week apart. And so this gives me, I basically sit with you for 4 hours to truly understand the symptoms that you're experiencing, like really like how does your body express the symptoms that you have different from someone else who has the same condition. What have you tried? What's worked? What hasn't worked? What's made you better? What's made you worse? All of your medical history, your family history, your social history, and just the progression of your health throughout your life. So knowing about your health as a child and a young, teenager, young adult is also very helpful. So the more that I know about you, the more that I understand about you, the more that I can effectively prioritize what is most important to in your case, so that we can, turn the ship around, so we can effect a change as quickly and efficiently as possible. Follow-ups typically are up to 45 minutes and up to 60 minutes for more complex cases. And those typically occur every 2 weeks. After I do the initial intakes, we'll do about every 2 weeks, we'll do follow-ups until I know you're feeling better. You're already on, we can tell you're on a good path. Then we begin to stretch that out. The next question is, a lot of people ask, how long does it take to heal? You can definitely start to feel better right away when we hit that correct homeopathic remedy. Even with naturopathic and lifestyle stuff too, all of that really, really makes a difference. And by the way, I forgot to mention, homeopathy and naturopathic medicine marry together very well. They support each other really, really well. When we get you on a diet that is helpful to your body, you will respond better to the homeopathic medicine. And likewise, when you're on the right homeopathic medicine, it helps you to make lifestyle changes even easier, because you have more energy, you have more motivation, you have more balance and stability to be able to continue forward to make these lifestyle changes that can sometimes be difficult to do, but which sustain your health in the long run. So you can start to feel better right away. I find that I do a check-in 1 week after you start your homeopathic remedy. And I would say about 90% of the people that I work with already have improvement within that first week. And again, you can have improvement even within hours, like you can just feel a little bit better after you start your remedy. But typically, we'll do the check-in in the first week, see how you are. I always give a remedy minimally 2 to 3 weeks, depending on what symptoms and what conditions you're dealing with, before we decide if it wasn't the right match and we need to move on to the next best remedy. But most people feel better even within that first week. So that being said, to really see long-term changes, I highly recommend that we work together for a minimum of 3 months. 3 months gives us a lot of time to really, for me to take your case, to get you started on your recommendation plan, and then to help you move forward incrementally, making those lifestyle changes and tweaking things as we go along, so that you're just better and better and better month to month. So I do offer 3-month and 6-month packages, and then for certain people, for certain chronic conditions, sometimes those will be renewed, depending on how long we need to work together. But 3 months is a really nice chunk of time to really get you going in the right direction. So I often liken illness to like a train moving in the wrong direction. So if in your illness, as the metaphor, the train is moving really fast towards the West Coast, and you want it to be going, that's in the direction of illness, and you want it to be going, in the direction of the East Coast towards health. We not only have to slow down the momentum of the train, we then have to turn it around, and then we have to build momentum in the opposite direction. So you can't just turn a train around, right? You can't just do that. It doesn't happen overnight. You have to slow the momentum, turn it around, and build momentum in the opposite direction. And that's what we're doing with your health. We're slowing the progression of the condition, the illness, and then we're reversing it and getting your health going in the opposite direction, so that we get you on an upward spiral versus a downward spiral. I do very often work with kids. Kids tend to be a big part of my practice as well. They do phenomenally with homeopathy. It's very safe, very effective for them. I can't imagine raising kids without homeopathy. I don't know what I would have done. My kids have very seldom ever needed a pharmaceutical drug, so that's been really nice. We've been able to keep their good bacteria in their guts intact because we haven't had to do round after round of antibiotics, etc., for common things that are often viral anyway. So homeopathy is just wonderful, and also for behavioral stuff too. I think it's easy to think about the physical symptoms, but irritability, attachment, whining, crying, anger, acting out, anxiety, feeling down, all of these things can be really, homeopathy can be very effective for treating all of these things in kids, these behavioral, mental, emotional things in kids too. And again, then we're not having to start them on a pharmaceutical drug or something that's going to definitely cause longer term effects on the child's both physical health and mental, emotional well-being as well. Lastly, people will ask me, can naturopathic and homeopathic recommendations or medicines be taken concurrently with medication? Homeopathic remedies, yes, they can be taken with other medications. So those don't interfere, don't interact, because homeopathy is a highly diluted form of medicine, and it does not work along the same biochemical pathways or lines as a drug or an herb would do. So we find that there's really not going to be a problem using homeopathic medicine and pharmaceuticals at the same time. However, with naturopathic medicine, with herbs and supplements, I do always need to double check if there's any interactions between those two. So I have various databases that I'll check to see what is safe with the medications that you're taking, and if it doesn't appear safe or it's questionable, we sort of table it and use something else that seems a little bit safer until we get you weaned down or off of a medication. If you desire that, if you desire to stay on your medication, that's fine too. We will use the things that are okay for that to use with that medication. So that is all that I have. I appreciate you watching this video. I really look forward to speaking with you at your free consultation, and just write down any questions that you have, and we'll definitely go over those at your visit. Okay, thanks so much. Bye-bye.